to get a sense from your perspective how you prioritize them. Senator Stone. Okay, thank you. Where am I? LAO, Finance. Excuse me.
Open domain revision, and then we'll make a recommendation to sub-4 jurisdiction.
Right. So this is primarily, Senator Stone, in sub-4's jurisdiction. And so we're going to keep it open through May revise. And we may wish at that point to make a recommendation to sub-4 based on testimony, what we've heard in its entirety, in the issue in its entirety today. Okay? That will be the recommendation. So, time to stretch. It's time for public testimony.
No, one more issue.
No, it's 13. Ms. Collins is trying to make me act like I don't know my job up here. Come on, Ms. Collins. So, to remind everyone, this is your opportunity. This is the second public testimony per our agreements at the top of the hearing. And this is your opportunity to comment on issues 1 through 13 on the agenda under developmental centers, starting on page 5 of the agenda and going through page 24. If you can, you don't necessarily have to tell us which issue, by issue number, but just, I'm sure many of you will be hitting multiple points given the fact that we've taken in a lot of information. Given the fact that we're asking you to comment on all 13 areas, won't cut the mic, but just really ask that you be cognizant of what's been stated before you. Feel free to say ditto. What's most helpful is to get new information from public comment versus repeat it. You can always just show your approval based on something someone has said so we get a sense that it's shared by more than just the speaker. We're going to try to keep it to around 2 minutes, but like I said, I won't, I'm going to try not to cut the mics, but I ask that you be mindful of the long line ahead of you and parts B and C of the agenda that are ahead of us. Yes, sir.
Thank you, Madam Chair. Kobe Pizzati with California Association of Psychiatric Technicians. I did want to speak to, I think it was issue 7, the Porterville issue. We support the governor's proposal to expand the beds at Porterville. We feel that there are far too many individuals with developmental disabilities in our jails and prisons right now that fully deserve to be in a developmental center setting where they have better treatment and have the better care that can restore them to competency. Furthermore, we would like to discuss the issue of the community state staffing program. While it was more of a success at Agnews when Agnews closed, the Lanterman closure was not successful at all. In fact, it was an epic failure. We had several staff that wanted to follow the individuals into the community and maintain that continuum of care. Unfortunately, we had members that were working at Lanterman for 30+ years that were forced into retirement because there were no providers that were participating in this program. Their options were either, basically go work at one of the state hospitals or go work at a prison. And when you work for a developmental center, you get really attached to the individuals and you provide care for these people for 35 years.
And that is that because their classification, kind of the nature of the work they did, was not happening at the community organization?
I couldn't even begin to tell you why it wasn't happening. When we were offered jobs, when you receive your layoff notice for the state, you're offered jobs at either, well, at Lanterman, I guess you would be Metropolitan State Hospital or Patton State Hospital or one of the surrounding prisons. Many of the psych techs that worked at Lanterman did not want to go treat that clientele, especially after, being trained to treat somebody with developmental disabilities. It's a different population, and it's certainly a lot more dangerous. So, thank you.
Next witness, please, 2 minutes.
Hello, my name is Mary Grangoff. Thank you for listening to me today. I'm a sister. My sister's been in Sonoma Developmental Center for 56 years. I'm also a board member of the Parent Hospital Association. I hope I'm speaking today for not just my sister, but all 400 plus at Sonoma who cannot speak for themselves. And I don't think the broad audience and speakers today understand that. My sister is classified as an 18-month-old, although if you look in her blue eyes, she's got the wisdom of the ages. My purpose today is just to tell you, as a family member, I'm not feeling the right thing to do is to throw her in the community. She will not thrive. She will not have the medical, dental, specialized services care that she deserves and has been provided in Sonoma because Sonoma is a community. I suggest bring the community back to Sonoma. You're wasting great property, great land. It was developed for this community. Build a new group home. There's lots of innovative folks who have great plans. Think outside the box. Utilize what you have. You have resources there. So that's my newness to you don't hear of anyone wanting to develop something new there in Sonoma. You want to just kind of dump it, sell it, whatever. Think outside the box. We cannot box all of those in Sonoma today. It's not a one-size-fits-all. That's all I have to say, and I thank you for listening.
Today, on behalf of your sister. Next witness.
Thank you very much for hearing us. My name is Helen Roundtree, and I'm a concerned citizen. And I speak for a large number of people in Sonoma. And I want to tell you that our citizens in Sonoma do not want to see that center closed. They want to see it transformed. And we are all behind our supervisor, Susan Gorin, and she is heading up a wonderful group of people who are developing a plan to improve the situation for the financial situation in the developmental center. We can partner with other people. We have room there to welcome more people that are mentally ill. The reason that the costs have gone up so much is because they have been dwindling down the population on purpose. So believe me, that is not the answer. We have got people that are sick on the streets, in the prisons, everywhere. And we have a wonderful opportunity to be able to develop this center there as the Northern California Center for Mental Health and Developmental Issues. Please, please, do not just think about the money. Think about, I am an accountant by trade, so I know that you can do all kinds of things with money. And you can rebudget things, you can move money around. Think about what you're spending when you have sick people in a prison. So please, think about the human aspect. Thank you.
Thank you very much. Next witness, please. 2 minutes.
My name is Vicki Basehart, and I'm a neighbor from the Sonoma Developmental Community. Notice how I didn't call it SDC, but Sonoma Developmental Community. It is a community. It's a community within itself. I've lived there for 30 years, and I've seen people come and walk and play and throw rocks, and I don't know where they would go if they couldn't do that. They've lived there half their lives or 3/4 of their life or most of their lives. To throw them out into a community home, I support community homes. I truly, truly do. But you can't put everybody in that same position. Some people need a home like Sonoma Developmental Community. It's not just about the money, okay? The other thing, I support community homes, okay? But what statistics do we have on community homes? You know, how many people get thrown out, go to jail, wind up dead? I know stories about people that left Sonoma Developmental Community and didn't last very long. So, you know, we got to take care of everybody, not just the ones that can go live in the community. Thank you.
Thank you. Next witness, 2 minutes, please.
Madam Chair, members, Carl London, I'm here today on behalf of the California Disability Services Association. As I've mentioned before, I'm also the parent of an 18-year-old young man now, having his birthday this year. And I've put my toe in the water and become a member of a community-based board and now serving as board president of an agency in Sacramento that's 63 years old and serving 400 to 500 people annually through the community system. I'll start just being quick by echoing what Dion Erner said. Dion gave this committee the clearest roadmap I've ever heard for how you solve this problem. Not a surprise given her background and who she is. I urge you to listen to that and take that course. I also want to echo what Jackie Dillard-Foss said. She represented well the fact that for every person sitting in a developmental center today, there are tens, hundreds, or thousands of twins sitting out in the community who look exactly like them. The only difference is they don't have a developmental center address. I would note that most of the items that you have in the developmental center area today relate to fixing the developmental centers and pouring money into doing that. You know, I think we have to stop the madness. Madness would be pouring more and more state dollars into something that isn't working, that's resulting in decertification. You had 4 units at Sonoma, 7 more now. You're at $500,000 plus per person. And I think I just heard another $126 million or $126 million total in more state funds needed to backfill due to decertification, plus whatever else is on this budget agenda that you have that was excellent, by the way. Meanwhile, the contrast there that you have to keep in mind is that we've only had 1 increase in community-based programs in 15 state budgets. 1, 2006-07, we took that away 2 years later, and just in the last 2 years restored that back to 2006-07 levels. Instead, what this legislature has done repeatedly is chosen to pour more and more money into these institutions that have produced documented abuse, decertifications, and we're now at the point where literally you have to choose at some point 280,000 people sitting in community-based settings versus the needs of the few remaining in the developmental centers. What I want to say that's hopeful, though, is I do hear a lot of common ground. I think everybody would say that with the people remaining, the goal ought to be to get them out into really good placements in the community. Look at their IPPs that every person has and make sure they get a very good placement in a community-based program. When you do that, and I can't believe we have a Republican senator saying this, we got to take advantage of that, by the way, but we have a Republican senator who is going out on a limb and saying, I don't want to take the money that the taxpayer dollars and fold it back into the general fund and just keep it. He's saying something novel for a Republican, in my estimation, which is, let's use it differently. Let's repurpose the money. We have the tax dollars. Let's make the whole system better for everybody. It's a unique moment, window in time. I encourage you all to take it. Thank you very much.
Thank you very much. Next witness, 2 minutes, please.
Linda Hemingway, Sonoma County Organizing for Action Chapter Lead. My comments are detailed in an in-depth letter signed by 14 chapter leads throughout the state. 3 points. What does a safety net for the developmentally disabled look like? I refer to a study commissioned by Governor Brown, which found that 19% of the residents could not live within the community. The Sonoma Developmental Center has the experience and expertise required to meet the needs of these clients. Point 2, health care services for all Californians. It is estimated that between 2.5 and 3 million newly insured Californians by 2019. Expanding services offered at the Sonoma Developmental Center to include general health, mental health issues, and veteran services would ease the health care crunch. Which leads me to point 3. Increased services will bring more revenue to the state, bring down the cost per patient for folks in the developmental center, stimulate the local economy, and create good middle-class jobs, not $10 or $11 an hour at a regional center, but good middle-class jobs where you can work full-time and be above the poverty line. This is a win for everyone, the patients, the folks within the Sonoma community, and the state, because by stimulating the economy and providing good jobs, tax revenue will increase. Thank you.
Thank you for your testimony.
Hello, Chair and members. My name is Matthew Gagnon. I'm here on behalf of the Sonoma Land Trust. First, I want to state our support for the testimony provided by Kathleen Miller of the PHA during the Issue 2 panel. The Land Trust has been working closely with the PHA and other stakeholders in Sonoma County on developing a comprehensive best plan recommendations for both the land and the people at Sonoma Developmental Center. Thank you.
Thank you for your testimony.
Hi, my name's Carol Wattillo, and I'm the director of an organization that's been around about 20 years serving people in day services focused primarily on employment, meaningful, purposeful daily activities, volunteering. And like Jackie said, we serve these people. I serve people that have come out of the development centers. I serve one gentleman that came out of the development center with a reputation this big and a packet that said he could not work in the community, he could not be around other people, he needed a very isolated situation. He works for the River Cats, not so isolated. He works for the Kings, not so isolated. He's thriving. He thrives in his community living situation with support. So like they've said, we serve these people. We're doing it. We're doing it for $170,000 a year at the very top, one-on-one, individualized services in somebody's own home, not over $500,000 with substantial reports of abuse in congregate living situation. The other point I'd like to make is that we got to quit thinking about beds and how many beds are available for people. We got to start thinking about what are the supports and services that people need in the community and then create those. It's not about 952 homes or ICFs or group homes. It's about where does this person want to live and what supports and services can surround this person so that they can live successfully in the community. And I really applaud you looking at the disparity between what I can pay my staff and what the DCs are paying. I spent a day at Sonoma Development Center about a year and a half ago. And I believe they're lovely people there, trying very hard, wanting the best for people. And the pre-vocational training that I saw that was going on was people being trained to work on a rotary dial telephone and how to do that. So what they're doing is not preparing people for the community. People need to come to the community. The community's prepared for them.
Thank you for your service. Thank you for your testimony.
I feel like I'm talking to the remnants of this whole process, which isn't a very good feeling, but nevertheless, I got here 9:30 this morning, and so I'll make my comments. My name is Joseph Bernhout, and I live in the Sonoma Valley. I'm a longtime resident there. I know a number of people with family members in the Sonoma Developmental Center. I've heard testimony from a number of people, and to a person, all the people I'm aware of want their family members to stay at the Sonoma Developmental Center. I don't believe that there's any sound basis to think that there's more abuse there than in the group homes. The Parents Hospital Association tried to get information from the regional centers about specific outcomes from the transitions, including mortality rates, numbers and forms of restraint, and what they got from the regional centers was a complete refusal to disclose any information, and the regional centers have adopted the position that they are not subject to the Public Records Act. So I think there's been a lot of very glib presentation here, throwing around a lot of large numbers, thousands of people under some broad category of disability, and then somebody saying that they're all exactly the same as the people in the developmental center. I don't think so. Now, I was at a conference.
Sir, we'll need you to start summarizing your comments.
Excuse me?
We'll need you to start summarizing your
Okay,
comments.
fine. Just one final, and I was here 9:30 this morning.
Yes, sir.
Okay?
We respect that. We have a lot of other speakers
Okay.
as well.
So one final comment, which is that I was at a conference at the coalition that's headed by Supervisor Gorin. It was an excellent conference. And at the very least, I would ask you people not to just shut down everything in the developmental center and preclude the possibilities there. Thank you.
Thank you for your testimony, sir.
What an honor to be in front of the legislature here. But my name is Marilyn Good. I live in Sonoma Valley and for many years. And I have a brief thing. One is that we are such a throwaway society. And it seems to me we're a little schizophrenic here. There's all those who want the regional centers, and you're building new regional centers. You're pouring money into that, and you're letting this gorgeous piece of property that is the jewel of our valley to be thrown up, you know, what's it going to be, another, I don't know what it could be, maybe put into vineyards. But it is a special jewel for us in our valley. And we believe that we just have this coalition that has a strong connection both at the federal level and the California legislation. Where I stand today, we are a determined group of voters, so please listen and work with us to create a win-win solution for SDC and Fairview. We don't want to have, what was that, what's the thing that bought Agnew? Anyway, that huge corporation. We don't want that in our valley, and we want our most vulnerable people to be taken care of. And it seems like the state has done the best it could to delay maintenance year after year since Mr. Reagan and Mr. Letterman said that, you know, everybody wants to be out in those wonderful group homes. And I've been in some of those group homes, and they are nothing like what we have here. And this is, the state owns it. Don't give it up. Don't sell it to Microsoft or somebody.
Thank you for your testimony. Thank you.
Good afternoon. I'm Michelle Ramirez. I'm the director of an agency called On My Own, serving approximately 350 clients with disabilities. This is a picture of my uncle Carl, who was born in 1956 with Down syndrome, pretty much nonverbal. The only option my family had at the time that the pediatrician told them was to go tour Sonoma. They did, and the story is that my grandpa said no and my grandma said hell no. 60 years later, the Latterman Act and many other social service systems put in place. I introduced to you my cousin Bailey, who was diagnosed with the same disability, and she just graduated from high school with her certificate. She's thriving. She's actually pre-employed and participating in programs. I've heard a lot of comments today, but my family made the choice, and I respect the choice of many families who make an opposite choice of what my family did. But there are people living in our state institutions today, hundreds of them, whose families have come and gone. They're there 30, 40, 50, 60 plus years. And there's nobody else to speak for them but us in the community that can say, you can have another option. I've heard terms being said today, throwing money after bad. Well, let's close Sonoma, let's close Fairview, let's put the money back into the community. The numbers don't lie, we do it. We do it in the community. It makes policy sense, it's fiscal sense, and it's a human rights.
Thank you for your testimony.
It makes sense. So
Thank you.
Let's think outside the walls.
Thank you.
Senator Stone and distinguished staff, Rick Rollins on behalf of ARCA, the Association of Regional Center Agencies, we've submitted a 3-page letter to you in detail on our position on this issue. The recent closures of Agnew's and Lanterman Developmental Centers highlight the regional center's commitment to support individuals in the community and the ability to do it successfully. ARCA supports the process to begin the planning for the closure of Sonoma and Fairview developmental centers with robust input from stakeholders, including residents and their families. As demonstrated by the successful closures of Agnew's and Lanterman developmental centers, thoughtful resource development and transition of each individual to the community requires adequate time. The median rates make it difficult to develop resources needed for former developmental center residents with the highest needs. They also make it harder to implement the community state staff program. ARCA recommends suspension of the median rates for resources developed to transition individuals out of developmental centers. Thank you.
Thank you very much. If you would indulge us, please. I'm trying to manage members coming and going. You see us all kind of in and out. I'm going to take some votes before Senator Stone has to catch a flight. So if you would just give us a moment, please, to go through the process, and I'll come right back to you. Fair enough? Thank you very much. And we're going through. Part B, Human Services agenda. starting on page 2 of the agenda. Successor, Trailer Bill 606, Successor Fund Designation. We recommend approval of the request. It was heard at the March 26 hearing.
So moved.
Okay, that's a 3-0 vote. Moving on to item 5160, Department of Rehabilitation. Budget change proposal, statewide funding for Social Security beneficiary work incentive planners. We will adopt placeholder provisional bill language.
So moved.
Thank you, 3-0. 5180, Department of Social Services, Child Welfare Services. Trailer Bill 602, approve relative caregiver funding options, program cleanup. We'll adopt placeholder trailer bill language.
Aye.
Thank you, 3-0. BCP 50, AB 1978, Child Welfare, Social Worker Empowerment, and Foster Child Protection Act.
So moved.
Recommendation approval.
So moved.
That's 3-0. Oh, I'm sorry. That's a no? Okay, so that's 2-1. Again, on the AB 1978 Child Welfare Services. Moving on to the April letter, BCP 83, implementing child victims of human trafficking. Recommend approval of the item. Subcommittee heard the item April 9th.
Aye.
3-0. 5180, Department of Social Services, Trailer Bill 604, Employment Development Department data sharing, approval of the placeholder trailer bill language. That's 3-0. And the final under Section B, under Health and Human Services Agency, Office of Systems Integration, Electronic Benefit Transfer 3 project, transition to the new EBT services.
Aye.
3-0. Everything? Okay, that's everything for Part B. Part C, under Health. And I'm going through this whole. Stops here. Okay. Part C, Health. I'm on page 16 of the agenda for those who are following along. Excuse me, page 3 of the agenda. Sorry. Department of Public Health, 4265. Number 1, the California Gambling Education and Treatment Services, CalGITS. Recommendation is to approve placeholder trailer bill language. 3-0. Biomonitoring Resources, April Finance Letter, approval.
So moved.
That's 2-1. Item 3, Food Safety Inspection, recommendation to approve.
Aye.
That's 3-0. Item 4, Food Safety Stipulated Judgment Appropriation and Trailer Bill language. Recommendation is approve and adopt placeholder trailer bill language.
Aye.
3-0. Item 5, USFDA Tobacco Retail Inspection. Recommendation is to approve.
Aye.
That's 3-0. Item 6, Inspection of Public Beaches Resources, SB 1935 of 2014, chapter in 2014. The recommendation is to approve.
Aye.
3-0. Item 7, Medical Waste Resources, AB 333, chapter in 2014. Recommendation is to approve.
Strongly aye.
That's 3 strong ayes. All right. Item number 8, notification of increases in federal grants. Recommendation is to modify the budget bill language to require the administration to report increases in federal grants over $400K on a quarterly basis, et cetera, et cetera.
Aye.
That's 3-0. Item 4120, Emergency Medical Services Authority. Item 1, document imaging workload and efficiencies. Recommendation is to approve.
Aye.
3-0. Item 2, disaster preparedness and emergency response resources for California. Recommendation is to approve.
So moved. No.
That's out with a 2-1 recommendation. Item 0530, the Health and Human Services Agency, Office of the Patient Advocate. Recommendation is to approve.
So moved.
That's out 2-1. Item 4140, Office of Statewide Health Planning and Development, OSHPD. Item 1, Elective Percutaneous Coronary Intervention Program Outcomes Reporting. The recommendation is to approve with a modification to the language.
So moved.
That's out 2-1. Item 2, Authority for Inter-Item Transfer of Funds. Recommendation is to approve and adopt placeholder trailer bill language. Out 3-0. Item 4150, Department of Managed Health Care. Number 1, Federal Mental Health Parity Rules. Recommendation is to approve. That's out 2-1. Item 2, Additional Enrollment in Individual Market. Recommendation is to approve. That's out 3-0. Item 3, Large Group Claims Data Exposure. Implementation of SB 1182 from 2014 statutes. Recommendation is to approve. That's out 2-1. 4, Dental Plans Medical Loss Ratio. Implementation of AB 1962. Recommendation is to approve. That's out 3-0.